Hi, you guys. Welcome back for our daily practice questions. It is day 77, and as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. All right, you guys, I still have one spot remaining for the upcoming FMP and AGMP 5 week intensive review. It starts April 21st through May 30th. If you're looking to join, click the link in the description. Question number one. All right, so question number one states a 58-year-old woman presents with sharp stabbing pain along the right side of her face, particularly around the cheek and jaw. The pain is triggered by touch, chewing, or speaking. Based on her symptoms, what is the most likely diagnosis? Is it A, temporal arteritis? Is it B, trigeminal neuralgia? Is it C, Bell's palsy? Or is it D, a migraine with an aura? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, based on her symptoms, what is the most likely diagnosis? And I always tell you if they're looking for a diagnosis, you need to run it back and look at those assessment findings. So here, the assessment findings show that we have a 58-year-old female who came in with sharp stabbing pain along the right side of her face, and is particularly noted around the cheek and jaw area. It's triggered by touch, chewing, or speaking. Y'all, this is classic presentation. Key identifiers that I always say to make sure you know. For a B, trigeminal neuralgia. I say, when I say this, you say that. This is one of those scenarios. When I talk about things being triggered by touch, chewing, speaking, it's particularly around the cheek and jaw, sharp pains to these areas. Think trigeminal neuralgia, okay? All right, question number two. Which of the following is the first line treatment for a patient with trigeminal neuralgia? Is it A, antidepressants such as amitriptyline? Is it B, anticonvulsants such as carbamazepine? Is it C, opioid analgesics for the pain management? Or is it D, surgical intervention immediately? Take a moment and tell me what you got, y'all. All right, so here the stem is the question is the stem, but it states which of the following is the first line treatment for a patient with trigeminal neuralgia? First line therapy for trigeminal neuralgia, the best answer is B. Remember, anticonvulsants such as carbamazepine, aka Tegretol, is the best treatment for trigeminal neuralgia and the first line therapy, okay? And then lastly, question number three. Which of the following cranial nerves is primarily affected in trigeminal neuralgia? Is it A, cranial nerve 2? Is it B, cranial nerve 5? Is it C, cranial nerve 7? Or is it D, that should be cranial nerve 3? What do you think? All right, again, stem is the question. The question is the stem. So it states which of the following cranial nerves is primarily affected in trigeminal neuralgia? Y'all, and a lot of my reviewers, y'all get these mixed up. So I wanted to throw this in to make sure you have an understanding and know which one is associated with which cranial nerve, right? But the best answer is B, it's cranial nerve 5. Trigeminal neuralgia is associated with cranial nerve 5, whereas Bell's palsy is associated with cranial nerve 7, facial, right? So a lot of times people flip those two, but again, trigeminal neuralgia is cranial nerve 5. All right, you guys, this was short and sweet, but I wanted to make sure to throw that in there to make sure y'all have an understanding of trigeminal neuralgia with this presentation, the treatment, and the associated cranial nerve. But as always, I hope you found this helpful. Please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Everything that I do offer is linked in the bio of this channel, including my website. But as always, if you're looking to book any of my one on one sessions, any of my custom packages or plans, or my question and analysis sessions, I always say either call, text, or email, as I prefer to speak with you first to gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.